Welcome to The Culture. We rest at the pulse of the community, providing all things news, music, fashion, events, and everything that we talk about in between. It's a lifestyle. We are The Culture. Thank you so much, Dr. Yvonne Johnson, for joining us today on The Culture. Dr. Johnson is the Chief Medical Officer at South Miami Hospital and also practices in the emergency medical facility. Is that
the emergency department at South Miami? Yeah.
emergency department at South Miami? Thank you so much for joining us. We did not stop in trying to get you on the show. We knew that you would be able to provide so much insight to our viewers. I want to jump right in. Last week, there was a lot of discussion around a 7-page report that the CDC put out. Some of the alarm came about the statistics that it revealed. African Americans in Los Angeles County make up 9% of the population, but 17% of COVID-19 related deaths. In Michigan, 14% of the population is made up by African Americans. However, 40% of the COVID-19 deaths are African American. It went on and on. In Wisconsin, Americans make up 27%, but they made up 70% of the COVID-19 deaths. Dr. Johnson, what is going on? To be quite frank, what's going on?
Jessica, first, thank you for having me. I think this is such an important topic. And of course, it's on the forefront of everyone's minds. And I think, it's interesting because I had heard before all of that came out that there was some thought in some aspects of the African American community that COVID actually didn't affect us. And that was kind of a rumor going around social media and other areas. And clearly, not only does it affect us, but it affects us disproportionately in many ways. So my take on what is going on in places like Michigan and Louisiana and California, there are several factors. One is you have to look at the density of the populations where COVID is primarily affecting in those states. So yes, African Americans make up a very small proportion of the population of Michigan as a state. But where the disease is primarily in the urban areas like Detroit. And we make up a pretty significant portion of that population. So I think you have to look at it in that context, first of all. And it makes sense because this is a communicable disease. So this is something that transmits from one person to another. The more closely people are together, like in an urban area, then the more likely the disease is to spread, which is the whole idea behind social distancing, is making sure that we can get away from each other. Certainly the populations in a lot of urban areas, and particularly in African American communities and African American households, that's very difficult. It's great if you live in a 3,000 square foot home and, everybody has their own bedroom, you can social distance from each other. But, if you're in a small apartment in an inner city, a typical type of dwelling in the inner city, it's very difficult to get away from each other. People live closely together. You're in apartments, you're not in single family homes in a lot of instances where you can be very separate from each other. So I think our socioeconomic living conditions make us prone to it. That's number one. But it's not even just about getting the disease. It's about what are our outcomes when we get the disease? So our outcomes from COVID-19 are so much more dramatically worse than other ethnic groups, particularly if you compare us to Caucasian populations. And even before COVID hit our shores, what we had noticed from other countries is that the people who did most poorly from this are older Americans. But aside from that, are people with other comorbidities, other illnesses. So things like hypertension, diabetes, chronic heart disease, chronic lung disease. And these are all things that are very pervasive in our community. particularly hypertension. The thing that is the most associated with a poor outcome are things that are very prevalent, in African American families. I can make it very personal. There's no one in my generation or my parents' generation in my family who doesn't suffer from hypertension. So, I think we have a disproportionate amount of those comorbidities that are associated with doing poorly. And that has severely impacted our numbers when you look at how well we survive this illness compared to others. I think the primary factors. And, it's really just highlighted the whole idea of the disproportionate delivery of healthcare in our communities. So, this is not something that came along just with COVID. This is something that COVID has now highlighted, that there's a disproportionate amount of chronic illness in our communities compared with other communities.
Right, which is now making us more susceptible to this virus, disease. What are we calling this?
Yeah, well, this is a virus that causes, in many people, causes an illness. And that illness has a spectrum of effect. So it can be asymptomatic, and in many people it is. It can be a very mild illness that has symptoms very similar to a cold, or sometimes even just a mild gastrointestinal illness. There are some people who get diarrhea from it. Others who just suffer a persistent cough or a fever. And in some cases, it may just be for a day or two that people are ill. In other cases, it can be much more prolonged illness. And then in many people, we're noticing that up to 20% of people who have this illness get sick enough to have to go into the hospital.
Oh.
So most people don't. If you think 20%, that means there's 80% of people who may feel very badly but are able to stay home.
Mm-hmm.
But there's a significant portion of the population, 20%, that we find pretty consistently have to go to the hospital. And then among those, there's a portion of that who gets sick enough to have intensive care, where they either need to have their blood pressure supported, or they need to have their ventilation, their breathing supported. And that's what so many people now, I'm sure, have come to understand, what ventilators, having a machine that forces the air in and out of your lungs to breathe for you, because in many cases people's ventilation fails them, their ability to breathe, because of the disease in the lungs themselves and the fatigue of trying to breathe in and out of lungs that are not working very well. Overcomes them, and they have to go onto a ventilator. And in most cases, in people that go onto a ventilator, it's a very prolonged illness. People are spending 1, 2, sometimes 3 weeks on a ventilator before they're able to come off. And unfortunately, many of the people who go onto ventilators are still not able to sustain life even with a ventilator. So there are, and that's the number that we're talking about, that's so disproportionate among African Americans in many places, that the number of deaths among African Americans is disproportionate because of all of those other illnesses that they have, in addition to coming in contact with this virus.
Mm-hmm. Are there some things that you can add to social distancing as it relates to African Americans who are obese, who have diabetes, who have high blood pressure? These are things that obviously aren't going to go away within this short window of time. But is there something other than social distancing that those people who are within that smaller range of being, I believe they said it's 30%, more likely to get COVID-19 or the coronavirus? Are there any things that they can do other than just social distancing that can prevent them from becoming a statistic and having a positive case?
Well, unfortunately, this is such a new virus, such a new phenomenon, such a new illness that we've not really studied it well enough to say with any definitiveness what works, what doesn't work. So, what I would be telling you is going on just my experience from having been, in medicine as long as I have, that make common sense to me. And in the same way that, say, developing heart disease from high blood pressure and diabetes and obesity can be affected by controlling those chronic illnesses. So you may not be able to control whether or not you actually get high blood pressure, hypertension, or diabetes, but you can certainly control if it you can help at least if those things are controlled. So you can make sure you're taking your medicine. And these days I know it's very difficult because physicians' offices are in many cases closed. They're not seeing patients because of the virus, but a lot of physician offices are taking patients using telemedicine. So I would definitely try to make sure you're maintaining your relationship with your primary care doctor, making sure you have your medicine. A lot of pharmacies are refilling your medicines, even if you don't have refills on them, because they know that we are in this situation and people are having a hard time getting in contact with their doctors. So making sure you're taking your medicine every day, making sure that you're eating a good diet. It's a lot of people I know are home and they don't have anything to do, and one of the things that we tend to do when we're bored is eat. So, that's we've got to watch that. We've got to make sure that, yes, you need to eat, but eat healthy. Make sure that we are getting fruits and vegetables to eat, and lean meats, and all of the things, and staying away from all those snack foods and the salty foods, and those things that we tend to do to eat when we're bored. Take this time to get some exercise. And you, you don't have to go, I know the gyms are closed and all of that, but you don't have to go out and be around other people. But you can go outside, you can walk around your neighborhood, and that's as simple as it has to be to stay into shape. So we want to do those things and I can't tell you that whether it's actually having hypertension and diabetes and those chronic illnesses, or whether it's having the uncontrolled version of high blood pressure and diabetes that makes you more of a victim, or have a greater tendency to be a victim of COVID. But it makes sense that you do as much as you can to control those things, to make them to normalize your blood sugar, to normalize your blood pressure, as opposed to having them be uncontrolled and having the virus on top of that. So I think the first thing you want to do in terms of social distancing, or in terms of controlling this, is making sure you don't get the virus if you have those chronic illnesses. So staying home, controlling who comes to your home, making sure that people aren't bringing anything to you. So, not having guests and company, you know, see people from outside of your window, or, do as we're doing with this, having Zoom conversations. I went on a Zoom happy hour yesterday. A lot of fun, got to see everybody, but, we were totally socially distanced. For people like me who have to go to work every day, making sure that when you come home, I hose down my shoes. I wear, these rubber shoes, they get hosed down every day. I take off my clothes, I head for the shower. We're wearing masks anytime we're outside. We're wearing masks in the hospital all day long. So making sure if you do have to have some contact, if you're going out to the grocery store, if you have to go somewhere, that's essential that you are wearing a mask. So doing all those things to prevent us from getting it, number one. But I think number two is, if you know you're at risk because you have those chronic medical problems, to do as much as we can to keep those things under control, to take our medicine, to eat well, to get some exercise, and to promote health while we're, cooped up.
Mm-hmm.
So,
Very
that's
practical.
exactly. And, we're learning every single day. We're learning more and more about this virus, and, the studies that are the controlled studies will come. But
Mhm.
right now, I think we just have to practice common sense
Mhm.
because that's all we really have to go on right now.
Those are good. Those are good practical tips. I wanted to also talk to you about the coronavirus lab test that has the federal government has just approved with Baptist Health. Can you tell us a little bit about that?
Yes, well, the Miami Cancer Institute, which is one of the entities at Baptist Health, has worked very hard to worked on a test for coronavirus for COVID-19. Recently got an FDA approval for the testing, and they are one of 12 labs in the country to gain that approval and certification. So we're really very proud of our colleagues at MCI and their ability to, do this very sensitive test. A lot of concerns swirl around the testing, the whole testing aspect of how accurate are these tests. If you get a test and it's negative, is it really negative? Because we want to make sure we have a very sensitive test, which means that it's going to capture the virus if you actually have it, that is that you'll get a positive test. And we also want to make sure that it's specific, so that it's not going to tell you that you're positive if you actually don't have it. So one of the things that MCI has worked on is a very sensitive test for this virus, so that if you get a negative test, we'll know that it really is a negative test. And we're really very proud that they have gotten this certification, and this is available for our community, particularly the community of cancer patients who are one of those communities at risk for COVID-19. They are immunosuppressed in many cases because of taking chemotherapeutic drugs, and we want to be as protective as possible of that community. So our hats go off to our colleagues at MCI.
Congratulations. I did want to talk to you a little bit about the vaccination for COVID-19. What is I guess how close are we to a vaccine?
So just from what I've heard in the media, that there are phase one testing that will be taking place in the fall, where they will be starting to give it to human beings, and testing for safety to make sure it's safe. They have done testing to develop to see if it's efficacious, and uh, but this takes a lot of time, because you're going to give it to a lot of people. So they have to make sure that this is safe, and you're going to give it to people who don't have a disease, which is very different than testing, on people who have a disease and maybe are, even at a life-threatening point of their disease, and you give them things that may not have been fully vetted. But if
Mhm.
you're talking about giving a vaccine, we're talking about giving it to a population of people who have not had a disease yet. So you have to make sure that this is very safe and that there's a reason to give it, meaning that it works, that it's efficacious. So this takes time. And so just the estimates that I've heard is that we're, at a minimum of a year away from that, and, maybe up to 18 months away from that. So, um, right now it's incumbent upon people to try to avoid getting the illness, particularly if you're at great risk of it, and to seek care if you do happen to get it, or you think you have it and you're having symptoms, and you're having symptoms that are concerning, like you are feeling very short of breath. Or feeling short of breath, I won't even say very, feeling short of breath, then that would be a reason to go in and be checked. Or if you have a very high fever, that would be another reason to go in and get checked, because the vaccine is quite a number of months away.
Mhm, mhm. Well, thank you so much for joining us. I wanted to not close without asking, did you have any closing thoughts or things that you would like for our viewers to be mindful of?
Well, I just want to say that I'm, really proud of our community here in Miami-Dade County. We have, I think, followed the guidelines for social distancing and stayed home to a great degree. People have really bent that curve that we've been afraid of. There were several weeks where we were really on pins and needles, being concerned that we were, may not have enough resources to take care of all of the people who would need to be hospitalized. And while we're still very mindful that, things could change, um, I really believe that the behavior of the people in Miami-Dade County has made a difference in allowing us to take care of those people who are sick, and to take care of them in a way that allows us to give our best to each and every one of them, because we're not uh, as overwhelmed as we thought we could be, and as overwhelmed as we've seen that people have been in other communities like New York. So I just want to encourage people to continue to do that. It's really very important, because, we can take care of 20% of a reasonable number of people who get the disease. What becomes overwhelming is if everybody gets the disease all at one time, and we have to take care of 20% of those people who would need to be hospitalized. So each and every one of us have been saving lives here in Miami-Dade County by doing our part and staying healthy, staying, apart from each other, staying home. And, I'm sure that we're anxious to get back to some semblance of normalcy. And as we're, able to, that will be lovely. But in the meantime, I'm really so very proud of our community, that we have pulled together like this. We've had people that have come and shown all kinds of appreciation to the caregivers at Baptist Health and at South Miami Hospital. And we've been very grateful for all of that. So I think that we're doing a great job as a community, and I just want to encourage everybody to, keep doing what we're doing, because it's working.
Well, Dr. Yvonne Johnson, we want to thank you from the culture. We appreciate everything that you are doing to help to save lives every day. And we just pray for your health, and we know that everything is going to be fine. We thank you once again for just joining us today.
Thank you. It's been my pleasure.
The Culture is produced and owned by Hip Rock Star Media and cannot be reproduced or broadcast without written consent by Jessica Garrett Motkins. All rights reserved 2020.